So here's a graph that illustrates why this all matters. The lines, if you look in graph A there, the lines demonstrate a steep increase in cardiac event rates for treated non-small cell lung cancer patients with coronary heart disease versus no coronary heart disease. If you look time following radiation therapy start, at 2 years, almost 12% of coronary heart disease patients had a cardiac event versus only 2.5% of the other group. So again, lung cancer patients with coronary heart disease require special attention. That's why it's so critical to identify people who don't even know they have coronary artery disease, but they have coronary calcifications. The necessity for radiation therapy, RT, for the treatment of many lung cancers adds to the potential cardiovascular disease burden in survivors. Radiation damages blood vessels and causes injury to heart muscle. Sometimes the heart is an unfortunate innocent bystander, sort of caught in the line of fire from RT. And you can see here in this chest X-ray, we superimpose some lines to represent the lungs. So they're in the center there. We have lines representing the heart, and we even have lines representing the coronary arteries. So we have LM is left main artery. We have left circumflex artery, LAD, left anterior ascending artery, right coronary artery. And you can see how easy it would be for the radiation, the beam of radiation, to also cross paths with the heart. So it can actually damage the heart tissue. It can damage the blood vessels of the heart. And radiation oncologists are attuned to this, and they do their best with different techniques to try to minimize heart exposure. We'll show you one simple technique. It's a simple breath hold technique. So they just tell people to take a breath in, hold it. They provide the radiation therapy. You can see on the left side, the heart is in the radiation beam. Patient takes a breath, the diaphragm goes down, pulls the heart a little lower, it misses the heart. So those are the sorts of things that help. So here's an example of what can happen if you can't get the heart out of the way. The two panels on the right side, those are myocardial perfusion studies. I don't know if any of you are familiar with like a Cardiolite stress test, something like that, nuclear medicine stress test. It's a myocardial perfusion image. We oftentimes use them to look to see if there's any evidence for a blockage or old heart attack. Basically, where it's all lit up there, that is the nuclear medical radioisotope that is distributed in the blood vessels, taken up into the heart tissue, and it releases x-rays that we then image with our scanner. And in the pre-radiation therapy slide there, the bottom of the heart, the tip of the heart, which is pointing at 1 o'clock there, you can see it's all nice and normal, but on the post-radiation one, it's gone. So what happened there is that part of the heart, the tip of the heart, was caught in the beam. It became scar tissue, and now it doesn't. Scar tissue is not vascular. Doesn't take up any blood. So that's scar tissue at the tip of the heart after radiation therapy. These are extreme cases. Again, radiation oncologists do make it their practice to try to spare the heart. Sometimes they can't spare it entirely, though, and that's where problems can arise. Depending on where the tumor is that you're irradiating, it may not be possible to get the heart out of the way. You're kind of stuck there sometimes. And so the question was, does it matter which side you're radiating, the left side, the left lung or the right lung? Yeah, it probably, where it's there, it probably does spare the heart. But you also have to worry about your blood vessels here too, because again, it's not only the heart, it's the blood vessels too. Say you were at a meeting and someone was talking about radiation damage to the blood vessels. But again, part of their job is to do planning, right? And so they map out where the tumor is, and then they try to figure out how are they going to direct the radiation to center on the tumor, but spare as much as possible any normal surrounding tissue. And so it depends which direction the beam is coming in. It depends on the strength of the beam. Sometimes they have techniques where they do a little bit from various directions, and so they're able to get the whole tumor, but there may be particular orientations where that kind of forms the bulk of the treatment. Certainly, radiation has a lot of effects and systemic effects.